Let's kick off the discussion by first talking about puberty and adolescence. Now, the age bracket of puberty and adolescence, and Dr. Dadina, I'll start with you on this one, is between, say, 12 to 18 years. Generally, women are fairly in good health at this period of time. But there are a lot of changes which are probably taking place physically as well as mentally.
Yes.
So, in that context, what are the key health risks to be aware of during puberty and adolescence?
So it's very important to ensure that the growing girl getting into adolescence and teenage years has a good diet, has enough physical activity, and has mental and physical well-being. We are seeing girls menstruating at a much earlier age now. In fact, in some cases, even as early as 8 to 10. So it's very important that they are given the information by parents or teachers or counselors to say that this is not an abnormal thing, because that girl is very confused, is kind of frightened that what are these changes. So it's very important, I feel, to have some sex education in schools also and have conversations with their parents who should impart the knowledge that what you are going through is a transition phase, is normal, and that don't be frightened, come talk to me when you're worried. Because the changes which happen, although they are gradual, can worry the child as she's growing. For example, we see teenagers with eating disorders, we see teenagers putting on an enormous amount of weight, which then in life can lead to polycystic ovarian syndrome. We see teenagers getting anorexic and bulimic because of the self-body image. So a lot of this can be prevented if there is more dialogue between parents and child and maybe a school counselor and child.
Okay. Well, Dr. Parikh, I'm going to get you into this conversation as well. And one of the queries we got was a lot around young girls hitting puberty early, getting their periods by the age of even 8 to 10. So why is it that girls are hitting puberty early? When should one see a gynecologist?
Now, you will be surprised to know that there is a very big role played by endocrine disrupting chemicals. And what your mother has eaten and what your grandmother has done has an effect, direct effect. It is called the transgenerational effect on the newborn, which means that today we are living in a world of plastics. We are living in a world where certain endocrine disrupting chemicals like bisphenol and phthalates are ubiquitous. We breathe them, we ingest them, we absorb them, and we drink them. So yes, one of the reasons why girls are hitting their periods early and why Indian women are reaching menopause early can be because of endocrine disrupting chemicals. So what Dr. Dadina said is this kind of education, which should be given at an early age, is imperative. It is important for parents and school teachers to see how we can vitalize girls by getting rid of endocrine disrupting chemicals from our micro and macro environment.
Well, Dr. Dadina, within this age bracket, there's a lot of questions with regards to the HPV vaccine as well. When should a girl take the HPV vaccine? When is she eligible to take it? How often? And do you recommend it?
So, yes, I recommend it very strongly. Any age after the age of 12 or 13 and up to the age of 45, I think all girls and women should be given this vaccine. There are 3 doses. The dose schedule is at 0 month, 2 months and 6 months. In fact, some countries in Europe like France and Austria and Germany are even giving it to the boys before they become sexually active. Australia, US has also started this because HPV is a virus which is carried by the male and transmitted to the female and causes cervical cancer. So if you can spread this awareness about the HPV vaccine, you will globally bring down your rate of cervical cancer. And we have seen it being very effective.
So the important point is that even older women can take the HPV vaccine even after they have finished having children, etc.
So up to 45 it's recommended. And generally we do what they call a liquid smear and check before administering it. But even if the patient has shown one of the viruses, there are 220 HPV viruses, in spite of which it is still to her advantage to take the vaccine.
Let's move over to reproductive age, which is basically 20 to 40 years. Dr. Parikh, I'm going to come to you. Women are working now, they're having children later. What should they know about fertility, and when should they probably consider IVF?
Well, it again starts right from the beginning. There are certain infertility disorders that get built up in childhood. And one of the commonest things is anovulation or inability to ovulate because of lifestyle conditions. The commonest such endocrine disorder which can lead to infertility is PCOS. And as we know, PCOS to a very high degree can be prevented by encouraging a good lifestyle, exercise, not sitting in front of the computer, not seeing the blue screen all the time, being disengaged from the phone, meeting friends socially, not on the internet, meeting them physically, doing physical exercises, trying to avoid eating things with a high glycemic index. Now, these are such simple things and simple values that can be given to children, which can prevent the burden of infertility later on. That's one. The other thing that we want to really emphasize on in our country is the burden of tuberculosis. Now, we know that tuberculosis, the incidence and the prevalence is very high in our country, and sometimes genital TB may not even be thought about by a couple. But this can be one of the major reasons for tubal blockage and infertility.
Well, Dr. Parikh, during this particular age group, 20 to 40, there are certain other medical conditions which one needs to consider as well. So, for example, what is the risk of health conditions such as chronic conditions within this age group? How susceptible are women during this age group? And what are the tests and vaccines you would recommend?
One of the commonest reasons for infertility today is wasting time and not considering that the biological clock stops ticking, slows down by 35, 36 and stops ticking by 40. Many women who are in their 20s and 30s feel that they can reproduce at any time. And once they've conceived, they feel that it's going to be very easy later on. So one piece of advice would be that look at yourself, look at your biological clock. As you're paying attention to your social commitments and your work commitments, please make a commitment to yourself to have rejuvenated yourself and being active in looking at your biological clock.
We have a question coming in about breast cancer awareness and what age should one start self-examination, screening? How should they be aware of what kind of tests they need to do, and what are the other vaccines which they should probably be taking during this age? What are the other tests that they need to be doing?
So what I normally recommend is everyone should do a breast self-examination, and the best time to do it is immediately after the period's over. It was thought that it is that the incidence is higher after 40, but it's not that a girl of 28 or 32 cannot find a lump. She may find the lump more easily if she's used to doing a breast examination on a regular basis. To answer about vaccines, we also see that we give the...
Or even diagnostic preventive tests.
So generally, we do a complete blood check to look for anemia, thyroid, the whole normal panel, the vitamin deficiencies. If there is a problem, we do the endocrine profile. But it was also very patient specific. You just don't do all tests for everybody.
Okay.
Another thing that we emphasize on after 40 is bone densitometry. And the pap smears, as recommended, should be done after a patient is sexually active. So if your smears are normal, then once in 2 years is the norm. But if you get a pap smear showing some abnormality, then you can even repeat it once a year. So if you're doing a self breast examination, a pap smear, a sonography once a year, you're pretty much looking after that something doesn't hit you as a surprise.
Okay. All right, Dr. Dadina as well as Dr. Parikh, we need to take a short break, but we have a lot more questions. We have to discuss perimenopause as well as menopause, all that on the other side. Stay tuned.